Hypertension, also known as high blood pressure, is one of the most leading world health problems, and over 20% of adults comes up with hypertension in their lifetime. Hi guys, welcome to my channel. I am Pharmacist God's Gift, and on this channel I talk on health matters and drug informations. If you're new on my channel, you are highly welcome, and if you're a returning viewer, thank you for stopping by. Right on this video, I'm going to tell you a lot of things you need to know about hypertension. What hypertension is, why it is called a silent killer, the basic classifications of hypertension you need to know, and also how to overcome hypertension naturally. If you would like to know about all this, then you have to stay tuned till the end. Welcome back. Now, what is hypertension? Hypertension. Looking at it, even you can suggest the meaning of hypertension. Hypertension is the increased pressure of blood that passes through the blood vessels. And these blood vessels are like tiny pipes that allow the passage of blood to the brain, the heart, and every part of the body. So when the force or the pressure that is passing through these blood vessels is increased, that is when it is known as hypertension. Also, the World Health Organization, which is WHO, describe hypertension as when the systolic blood pressure of an adult within the age of 18 and above is greater than or equals to 140 mmHg, and when the diastolic pressure is also greater than or equals to 90 mmHg. Now to the types of hypertension. There are actually two types of hypertension. One is the primary or essential hypertension, and the other one is the secondary hypertension. The primary hypertension occurs in over 90% of persons, and the cause of the primary hypertension is still unknown. But those who are at high risk of the primary hypertension are those who are diabetic, the overweight, those that consume high fat or salt diets, the smokers or the second-hand smokers, that is those that always inhale the smoke of those that are smoking, and also those that take excess intake of alcohol, those that practice sedimentary lifestyles, and those that are always stressed, family history, age, gender, and a lot more. The second one is the secondary hypertension, and this is as a result of underlying diseases. Secondary hypertension occurs in about like 10% of cases. Causes of the secondary hypertension can be as a result of renal diseases like kidney disease, hormonal or steroid intake, like the overuse of contraceptives, and also pregnancy, and a lot more can lead to secondary hypertension. Now, looking at the two types of hypertension, the primary and the secondary, and also the percentage of occurrence of the hypertension, you can see that almost everybody is at risk of getting hypertension. So it's always best for you to look out for what you should practice to prevent hypertension. Now, let's look into the classification of hypertension. Hypertension or high blood pressure is usually classified into four. 1. The normal blood pressure. 2. The pre-hypertension, that is before hypertension. 3. Stage 1 hypertension and stage 2 hypertension. This classification of hypertension is put into place according to the figures that comes out after you have checked your blood pressure. In one of my videos, I've taught everyone how to check blood pressure accurately at home. So today I'm going to show you the real values that you are going to see to know if you have hypertension, normal, pre-hypertension, stage 1 or stage 2. The normal blood pressure of an adult individual should have a systolic of less than 120 mmHg, all over a diastolic of less than 80 mmHg. For pre-hypertension, the systolic is between 120 to 139 mmHg, and the diastolic is within 80 to 90 mmHg. Then when it comes to stage 1 hypertension, The systolic is between 140 to 159 millimeter mercury all over. Diastolic pressure of 90 to 99 millimeter mercury. In stage 2 hypertension, the systolic is greater than or equals to 160 millimeter mercury, while the diastolic is greater than or equals to 100 millimeter mercury. Those are the ranges that are used in the classification of high blood pressure or hypertension. Therefore, one with persistent pre-hypertension is also at high risk of stage 1 hypertension in their lifetime. Do well to check your blood pressure once in a week or once in 2 weeks. Do you know that hypertension is also called a silent killer? Look at it this way. You might feel that you are okay, not knowing that your blood pressure is very high. I had this patient that was so happy that she was able to check her blood pressure in the program that we are having on Hypertension Day. The lady said that she never knew that her blood pressure was high until she checked it that day. The previous day, her body was feeling so bad that she asked to bathe like 3 times, not knowing that her blood pressure was high. That is a silent killer. That blood pressure being high and unknown to her has been killing her silently. Had it been she was opportuned to check her blood pressure and take her medication that day, do you know that she would have died of it? But all thanks to the Association of Community Pharmacists who brought out that program to save that woman's life. That's why we always advise that you check your blood pressure once a week or once in 2 weeks. When a person becomes hypertensive, the goal of therapy is usually a long-term one. Also, the person will have to take the anti-hypertensive drugs all through their lifetime. You see, it's not easy. So I'm going to show you right now ways to adapt to live a healthy life that reduce the chances of one getting high blood pressure or hypertension. Remember, I told you that everyone is at risk of hypertension. Looking at the causes of hypertension, the first healthy lifestyle you need to adopt is reduction of weight. Go check your BMI and know if you're obese or not, and look for ways to reduce your weight. You do exercise, intermittent fasting, and a lot of ways to reduce weight. Secondly, reduce the intake of salt and high cholesterol containing food. Those of us who are into eating fries, you don't actually know the type of oil they use, so you have to be careful. Eat foods that are rich in potassium and calcium. Eat a lot of fruits and vegetables. This doesn't only prevent you from being at risk to hypertension, but it also helps to boost your immune system and does a lot of wonders in the body. Fourthly, practice moderate physical activities. Stop that sedimentary lifestyle. Cease smoking. And also reduce the intake of alcohol. Not every day you want to take 2 bottles, 3 bottles, 4 bottles. No, reduce the intake of alcohol. If you are the chronic type that are so used to alcohol, you can do it 2 bottles a day, and you gradually come to 1 bottle a day or even 1 bottle a week. That is not bad. Start from somewhere to reduce the intake of your alcohol. Okay, let's move down on how to overcome high blood pressure naturally. The ways to overcome high blood pressure naturally is similar to that of its prevention. So now let's look at some natural ways to reduce high blood pressure. The first thing you need to do to reduce high blood pressure is your diet. How is your diet? The intake of salt. How is it? Is it high? Is it low? Try as much as you can to reduce the intake of salt. And high cholesterol. There are bad cholesterol and also there are good cholesterols. Speak to your health provider. Let them show you ways to select this good cholesterol from the bad cholesterols. Your diet should contain calcium, potassium, antioxidants that helps to prevent heart diseases, and also omega-3 fatty acids like the fish. And finally, your diet should contain magnesium. All these nutrients that I mentioned are mostly found in a lot of fruits and vegetables. So add fruit and vegetable to your meal on a regular basis. Like the omega-3 fatty acids are contained in the fish, the seeds, the nuts, the peanuts. So you can incorporate them into your food to help reduce your blood pressure drastically. Secondly, reduce the intake of salt, either added salt or processed salt. So our mothers, our fathers, or our brothers and sisters that like to add salt into already cooked food, that is bad and lead to very fast increase in the blood pressure. Also, I think there are salts that are made for diabetic persons and also hypertensive persons. So be the first one to select your salt. Thirdly, reduce the intake of red meat. I will advise you do chicken, and also know that the back of the chicken is not good for hypertensive patients. So the best thing is to eat the chicken white. Fourthly, reduce the intake of high cholesterol containing food, like watch out for the groundnut oil you use. Make sure they are groundnut oils that are low in cholesterol. Fifthly, reduce the intake of sugar to the barest minimum. That means reduce the intake of your carbonated drink, just any drinks or anything that contains sugar, just reduce it. Others are be physically active, you can do moderate exercise, and also stop that sedimentary lifestyle. Quit smoking and reduce the intake of excess alcohol. All these things are triggers or they are risk factors to hypertension. Also, avoid stress, drink a lot of water, and take a lovely sleep. Sleep and water are very effective therapy to healing in many disease conditions. Don't just give that hypertension a chance to stop your daily activities. See your medical health provider. Tell him or her the challenges you're facing with your blood pressure, and they'll be able to give you good advice on how to go about it. Don't stop your medications. Continue your medications. Take them every day to prevent hypertension emergency or urgency. Finally, don't combine your antihypertensive medications with any other drug or herbal drug. Always seek the advice of your health provider before combining them with any other drug. Take care of your health to help your health take care of you. Thanks for staying tuned till the end. I hope this was helpful. Keep coming back for more interesting and educative videos on this channel. Please don't forget to like, subscribe, and click the notification bell for more.